Hey everyone, welcome to Taking the Pulse, a healthcare and life sciences podcast. I am Heather Hoops Matthews with NP Strategy, here in the studio with Nexen Pruitt healthcare attorney Matthew Roberts. Matthew, good to be with you.
Good to see you.
We are honored to have join us today Dr. Patrick Cawley. He is the CEO of MUSC Health and Executive Vice President for Health Affairs of the Medical University of South Carolina. Under Dr. Cawley's leadership, MUSC has become an award-winning provider of outstanding care to patients. Dr. Cawley, thank you so much for taking the time to join us today.
Yeah, thanks, Heather. I'm really happy to be here and have this conversation. Matthew, good to see you.
Good to see you. Thank you again.
Well, let's start with some good news. MUSC was ranked once again as South Carolina's #1 hospital and health system. Congratulations on that. And if you could start by telling us what sets MUSC apart.
Well, I think a couple things, Heather. First of all, at our core, we focus on three things. That's a clinical achievement, #1 hospital, but MUSC at its core is really a combination of clinical care, meaning we take care of patients. We also teach. We have a lot of different learners, medical students, nursing students, et cetera. And then we do research. So when you put all three of those together, I think that's what develops the special sauce and, helps you take great care of patients because you have to teach it and you're doing research at the same time. And then it forces you to be really cutting edge. What is the edge of medicine? What is the edge of healthcare? So when you put all those things together, I think that's the secret sauce to achieving that year over year over year.
Dr. Cawley, your OB/GYN and ENT programs have recently been singled out as high achievers in their specialties. What is MUSC doing with respect to fostering innovation and excellence in those two areas specifically?
Well, I think it's really more the same, but specifically in those areas. So I'll take OB gynecology. So we take care of a lot of very sick mothers as well as women with gynecologic problems. The team there fully embraces the most difficult situations and forces them to hire great people. And, they just embrace the teamwork associated with that. Our ENT team is the same way. And our ENT means ear, nose, and throat. That's a very eclectic group. Our head and neck surgeons, particularly for cancer care, are world renowned. Our hearing team, who works on things like specialty approaches to helping people hear better. They're also world renowned. So they take great care of patients, but they teach at all levels and they do cutting edge research. So I think that makes them just really, really good examples of what I talked about earlier.
Okay.
I've watched MUSC expand its reach across South Carolina over the past several years and just continuing. How do you manage rapid growth and why is it important to MUSC to expand?
Well, let's take the latter part of that question first. Why expand? So healthcare has changed a lot in the last 10 to 15 years. And if you're not delivering, what I call whole person care, in the past, we could deliver care and patients could come to us and we could just take care of them for one slice of who they are. They'd come to Charleston and we take care of that. They go back home. But increasingly, care has to be whole person care. So you have to meet the patient where they're at. You have to meet them in their home and in their community if you're really going to get your arms fully around healthcare. And given telehealth, we've been a big believer from the beginning on telehealth, and it allows you to expand out more. And the more you do that's what people want. They don't want you to just take care of your eye problem or your left heart problem. They want you to see everything. So we decided we had to be more aggressive about doing outreach. When we start to do a little bit of outreach, send our doctors and nurses out, that led us to build more clinics. And then eventually it led us to develop hospitals, and before you know it, you end up physically across the entire state. So, that's how that growth happened. That didn't happen overnight. That happened over many, many years of just trying to deliver better care. The second question is, how do we manage that? Well, as you grow and as you get, different than you were, you bring new team members in. Your current team members, they may be fine at the current level, but they're not ready to go to the next level. So you constantly have to reassess who the team is. Do they have capabilities, et cetera? It's really, for us in the last 5 years, it's been almost a constant turnover of people and reassessing. And this is what you got to do when you're a growing enterprise. You have to constantly reassess that, because not everybody's ready to go to that next level. Some people are, and great for them. And we pat them on the back, and we encourage them to do bigger and greater things. But then some people, you just have to say, best for you to stay here, and let's get somebody else to do that next level job. But
Right.
It's a constant reassessment.
Right. You mentioned telehealth, and MUSC's Center for Telehealth is one of only 2 national telehealth centers of excellence. And you're also the headquarters for the South Carolina Telehealth Alliance, which was crucial during COVID. But what made MUSC take that leadership role in telehealth before anybody else did? We all know it's important, but you sort of set the standard for it across the state.
Well, I mean, it's a little bit of an interesting story, Matthew. About 10 years ago, just as I was the chief medical officer prior to stepping up into the CEO role. Right in that period of time between me being CMO and stepping into the CEO role, we were offered an opportunity by the state to do some telehealth development. Very small dollars at the time that the state put forward, and we were offered it at MUSC. It was kind of tossed around internally a little bit. I grabbed it and said, we'll be happy to take that and run with it. And we used that to develop this center within MUSC. And then we developed this carve out called the South Carolina Telehealth Alliance, which was really beyond MUSC. It was really meant for the entire state. And it just became the place, if you wanted to, if you were a believer in telehealth, that this was the future, this is where you came. These were big believers. And we started with things like the stroke network. 10 years ago, stroke care in South Carolina was very fragmented. There was a lot of telestroke occurring, but it wasn't connected. Everybody had their own proprietary systems. But this group said, listen, we got to be connected. We got to get outside proprietary systems. They need to be secure and safe, but let's start talking about linking together. And, today we can say that every single South Carolinian is now within 1 hour of expert stroke care. And that's a phenomenal accomplishment in that period of time. And that's just one of the stories that many have developed. It goes back to this original belief. You got to go meet people in their homes, in their communities, if you want to deliver the best care. And I'm a hospitalist. That's my medical background. I've taken care of a lot of patients in small and more rural communities. It is hard to deliver cutting edge stroke care without a telehealth linkage. And this kind of thing helps. So we think it's the future. We were at it for 8 years. Then COVID came along. It was good timing. It allowed us then to just pivot a little bit in order to get the telehealth going more. But COVID really tested telehealth and showed that it can be leveraged up pretty big if you wanted to.
What about the payers' acceptance of telehealth in the post-pandemic world? We know that's been sort of a question which I don't know has been definitively answered yet. We know they paid for it during the COVID pandemic, but what about going forward?
Yeah, I took a deep breath as you asked that. It's a little frustrating. Sometimes the payers recognized how helpful it was during the pandemic. So I don't fully understand the reticence afterwards. The data's a little mixed. I get it. There is some data to show that potentially telehealth could raise the amount of healthcare costs. There's other data to show that it won't. I just don't know how you retreat.
Yeah, it is the future.
Yes.
Yeah, there's no way we can go back.
Yeah, that's where I'm at.
Yeah.
And I still think at the end of the day, to the individual patient, I think it's a less expensive option in many, many, many circumstances.
All right.
Oh, without question. I live in McClellanville, and for me to be able to do virtual with your team, Dr. Cawley, and not leave my house in McClellanville and not have to come to downtown Charleston, it's absolutely better on a patient like me.
Absolutely. I was just talking to somebody yesterday, who said, they were sick and, having a lot of upper respiratory symptoms. They didn't want to leave their house. And they had called me and they said they were having trouble accessing. And I said, just use our virtual urgent care. They called me back about 2 hours later and said, God, that was fantastic. I'm even having the medication delivered to my house. I mean, if you are sick and you don't need specialty care, you don't need to be seen in an emergency room, what better way of being taken care of than telehealth?
Continuing on that theme of going to people's homes, let's talk about organ transplants. We know they're life-saving procedures, and MUSC is now working to expand your transplant program across the state to hospitals in rural South Carolina. Will you talk about that?
Well, maybe not a lot of people realize, but, there are not enough organs to cover all the organ transplants needed in the United States. And but what you have to do, if you really to develop more organs, you got to bring the initiative more local. When people begin to understand and they can connect that, say Matthew or Heather needs a organ, they're much, much more likely to donate, if they can. So you have to make it very, very personal. So we believe that if you're going to bring this life-saving technology, you got to bring it down to the community level. So, historically, people went to big transplant centers in cities, but we think, we need to keep that going, but let's try to also bring it to the community. So we've been talking about this for a few years, and we decided that we would try to bring this to our Lancaster Medical Center in Lancaster, South Carolina. They're in a good location, smaller, more rural community, but reasonably still sized. We thought they would do well, and not at all the typical hospital you would set up a kidney transplant program. But we did that, got it started. It started in the spring of 22, and as of last week, they had done about 25 kidney transplants in that hospital, in that community. And that wasn't 25 people that were transferred from Charleston to Lancaster to get that done. No, those were 25 new people really from the upstate of South Carolina that either weren't going to get transplanted or were going to have to travel much further away. So we're super excited about that. That example works. We are planning to bring that to other similarly sized medical centers across South Carolina in the future.
Great. That's great news. Let's talk a little bit about the nursing shortage. We know that's affecting everybody, but for an entity like MUSC that goes statewide, you've got some interesting partnerships with technical colleges to try to help train nurses. Talk a little bit about that, if you will.
Well, the nursing shortage is really complex. If you ask some experts, will say if you look at it across the entire United States, there's not a shortage. They may be technically correct, but if you look at highly rapidly growing areas, that's where the real problems are. You just can't get enough people there. So that's why we have a big problem in South Carolina. Part of it's pay, so we're trying to address that. But then part of it's just getting people to get trained. And what we've discovered is we really got to team up with nursing schools. And there are the big nursing schools across the state, MUSC, USC, Clemson, but then there's a lot of technical college nursing schools. That's really where the bulk of nurses are trained, because there are so many technical schools. So we're linking up at the local level. We're in many different communities, so it's easy for us to team up with 6 or 7 different the technical schools to try to shore up and, first of all, show young people that this is a great career. And then you can go to school local. You can go for much, much less expensive. And then, we'll give you rotations, and we'll even give you a job at the end of it. So
Right.
This is something that we didn't do as much in, maybe 3 or 4 years ago, but we're definitely making inroads here and teaming up like we haven't before.
Last question for you, Dr. Cawley, and thank you for the rapid fire on all these different topics we've been throwing at you. Let's end by looking at the future and talking about the next generation. So MUSC has started investing in a South Carolina Health Equity Consortium. And right now, a dozen undergraduates are gaining experience there in the MUSC Hollings Cancer Center laboratories. What is this and why?
Well, it goes a little bit back to what I said before. A lot of young people don't understand the type of different jobs and career opportunities in healthcare. I think we made an assumption in the past that they know. But they really don't. And in fact, MUSC is part of a statewide effort through the South Carolina Hospital Association to get young people to understand just the many, many different types of jobs. Everybody knows about doctors and nurses, but there are great jobs in research labs, all kinds of technical positions. I mean, just numerous types of jobs in healthcare and in academic health systems. And then this problem is even more acute in underrepresented minorities and in poor communities. They just don't have as much knowledge. So what we're trying to do is reach out and try to connect with people and directly show them what some of these opportunities are. Almost in every single case, when we show them opportunities, they consider things that they had never, ever seen before. So that's success. So if all of a sudden they start thinking about, boy, that's a job I might like, or a career I might like, then we've done our job. So we're pushing on that just as hard.
That's a blessing for both them and for you.
Oh, for sure.
Right? Brings good talent in.
Well, and it's a blessing for their community, because in many circumstances, these are often good paying positions, and they're going to bring those dollars back into their own communities, which further help their communities.
Dr. Pat Cawley, thank you so much for your time today and for the good work for you and your MUSC team. It's exciting to hear about all these different topics. We hope you'll come back one day. Join us again.
Absolutely. Thanks, Heather. Thanks, Matthew.
Thank you.
For those of you who joined us today, we hope you got excited a little bit about the conversation and what you heard that's going on at MUSC in South Carolina, across the state. We look forward to seeing you next time right here on Taking the Pulse, a healthcare and life sciences podcast.